Thank you all for joining us today. I wanted to welcome you to our the latest webinar in our AHD webinar series, which is a student perspective, growing academic health department partnerships through student internship programs. My name is Kathleen Amos, and I'm the Assistant Director for Academic Practice Linkages at the Public Health Foundation. And we are pleased, very thrilled to be joined by a number of speakers today to discuss student internship programs, which are often a core part of academic health department partnerships. So just before we dive into the webinar, we always like to go over just a few housekeeping items. As you likely noticed when you logged into the webinar, all participants in the webinar today are currently muted. We should have time for questions and discussion today before the end of the webinar. Please feel free to use the chat box to ask questions or share comments with us at any time, and we'll address as many as possible when we get to that Q&A discussion session following the presentation. When we get to that point, if we have enough time, please also feel free to raise your hand if you prefer to ask your question out loud. If you have any technical difficulties as we go through the webinar today, please also just drop a note in the chat box and we can help troubleshoot that. The slides for today's presentation are available, and we'll put the link to where those live in the chat box as well. So if you'd like to have a copy for your own, to scribble on, or to access any of the links that will be shared during the presentation, you can grab those there. And finally, we wanted to let you know that this webinar is being recorded and the archive will be available following the event to you as well as to others who were unable to join us today. So the Academic Health Department, or AHD, partnership work that we engage in at the Public Health Foundation all falls under the umbrella of the Council on Linkages between Academia and Public Health Practice. So we always like to start with a few words about that group. The Council on Linkages is a consensus-driven collaborative of national organizations that are engaged in public health that works on initiatives that are designed to benefit the workforce as a whole. So the Council on Linkages aims to improve the performance of individuals and organizations within public health by fostering collaboration, promoting ongoing education and training, and strengthening public health infrastructure. The Council currently has 21 member organizations that you can see on the slide here, and span a range of professional groups and federal agencies engaged in public health. Council on Linkages is staffed by the Public Health Foundation, and we're incredibly grateful to the Centers for Disease Control and Prevention for their ongoing support that enables this effort. The Council on Linkages has long had an interest in and supported AHD partnerships, which for anyone who's less familiar with these partnerships are kind of formal partnerships that join together a health department and an academic institution. So these partnerships can take a variety of forms, but at their core, they're designed to be collaborative, mutually beneficial relationships that serve to enhance public health education and training, research and service. In some ways, these are very similar to the types of relationships that you see between, for example, teaching hospitals and medical schools. AHD partnerships may be formalized by a written partnership agreement, and the activities may involve sharing personnel or resources between the organizations. And however they're structured, these partnerships really serve to strengthen those connections between public health practice and academia, enhance the capacity of the organizations involved, and further that pipeline into governmental public health. The Council on Linkages operates an academic health department learning community, which is designed to support organizations working to develop and sustain AHD partnerships and really provide an opportunity for people to explore the idea together and learn from each other as they're working on this. The learning community has been around since 2011, so 10 years now. It's open to anyone who's interested, and we currently have around 1,100 members from all across the country. And the learning community is involved in sharing stories and highlighting AHD partnership work that's happening across the country through opportunities like today's webinar, developing resources such as we have a collection of partnership agreements that organizations have used to formalize their partnerships, enabling dialogue and assistance among other activities. So with that little bit of background, I'd like to turn the floor over to Emily Waldron, who's the Community Engagement and Outreach Coordinator for the University of Arizona's Melanita Zuckerman College of Public Health. We are absolutely thrilled to have Emily and 5 students who are participating in their AHD internship program join us today. And collectively, they will talk to us about what they're working on and how that program operates. So Emily, the floor is yours.
Great. Thank you, Kathleen. So hello, I would like to first start by thanking Kathleen and the rest of the folks with the Public Health Foundation for hosting this exciting webinar. If we can go to the next slide to the learning objectives. Today we're going to talk about four different things. So the first one is we're going to talk about the goals and the structure of an academic health department internship program, particularly ours, describe the benefits of the academic health department internship program for the student intern, provide 2 examples demonstrating how students perform core public health services through the AHD internship program, and explain how AHD student interns serve as a critical link between the local community health departments and the universities. So today, I just want to also say, as Kathleen said, my name is Emily Waldron, and I'm the Community Engagement and Outreach Coordinator with the Melanita Zuckerman College of Public Health. I coordinate the academic health department activities under the Office of the Associate Dean of Community Engagement and Outreach, Dr. Cecilia Rosales. I also want to give a huge shout out to our health department partners, many of who are here today. We love to do these webinars with our health department partners, but as we all know, vaccines right now are in they're so busy with that. So we thought this would be a great opportunity to highlight some of our students, the work that they're doing in collaboration with our health department partners during this busy time. So today I am thrilled to be here with our spring 2020 student intern. So today you're going to hear from Kendra Claridge, who's a public health senior from Grand County, which is in southeastern Arizona. Aiden Grijalva, a physiology student from Marana, Arizona, which is a small town in Pima County, which is where the University of Arizona is located. Erin Kenny, a public health student and graphic designer who calls home Windsor, Colorado. Jessica Martinez, a public health student, bilingual in Spanish and English, and also a graphic designer. Jessica is from Tucson, here in Pima County. And finally, we have Sophia Maturana. She's a senior from Phoenix, Arizona, studying psychological sciences, Spanish, and linguistics. Sophia is also bilingual in Spanish and English. So I'm so excited for you to hear today from all these students about their internship experiences and how they perform core public health services to serve as a critical link between the local community health departments and the university. So I want to start out by just giving a little information about the College of Public Health. So we call it the Melanita Zuckerman College of Public Health. We call it MEZCOF for short. MEZCOF was established in 2000 and is right now the only accredited school of public health in Arizona. See, the academic health department falls under the Office of the Associate Dean of Community Engagement. And in Arizona, we have 15 counties, and our college's goal is to have a presence to advance public health in each county. So we currently have academic health departments with Cochise County, Grand County, Pima, Pinal, and Yuma County. So those are all on the bottom, the southern part of Arizona. You can see on the map where these counties are located. And as I mentioned before, the University of Arizona's College of Public Health Tucson campus is located in Pima County, which is in southern Arizona.
All right, so I'm one of the interns, and I'm going to talk to you about the assessment of need. So there's been a history of successful partnerships with county health departments and on community-driven projects. So with these partnerships come challenges such as sustaining relationships between the county health departments and the college. There's also staff changes between the college and county health departments, as well as the interns graduating. So this can result in there no longer being a connect between the college and the county health departments, as many interns are that connecting factor. The interns also form a strong relationship with the health department that they work with oftentimes. And so when the interns graduate, sometimes that relationship is no longer there. So most graduates are required to complete an internship to graduate. The benefits that come along with this internship are students having the opportunity to apply skills learned in the classroom to perform public health essential services. So health departments are often understaffed and rely on public health interns who utilize their academic skill set to support certain community-driven projects. So some examples of what interns have to offer these health departments are familiarity with the local community, public health and/or graphic design skill sets, Spanish speakers, and excellent communication skills.
So I am another of the interns, and I am going to talk to you about the Academic Health Department initiative. So essentially, an academic health department enhances the public health education and training, research and service by facilitating collaboration across the academic and practice communities, allowing students to gain experience and help them connect their work back to the topics that they're learning in their classroom settings. So MESCOF has established 5 academic health departments since 2018, and it has shown for student interns to play a huge role in their work and to be critical for these collaborations. Well, many of the collaborations result from the students wanting to give back to their communities and help back tackle health concerns that each of their communities may have and be presenting. So just a little bit of the work. On the right is a small graphic that was created by a fellow intern representing our old main building on campus. So that's a little bit of the work there.
So I will be talking about the 4 main goals that the Academic Health Department orients the program around for the student interns. So the first one, provide the student with an opportunity to perform at least 2 core public health functions in the practice-based internship. 2, provide health department staff with sustainable student support, and this is regardless of the major they belong in, as long as they have that interest and passion for public health. 3, implement projects directed by health department staff and spearheaded by students from the local community to increase dialogue between health department staff and faculty. And 4, provide opportunities for students who are from or familiar with the community where the health department is located to collaborate with department leaders and faculty to establish academic health relationships to improve the overall health of the community. And we'll see many examples from all the student interns here as we go through this presentation.
Great, thanks, Sophia. And she's right, there's some really interesting examples coming up. So essential public services, so these really inform our internship. So these core public health services. So Public Health Essential Service 3, communicate effectively to inform and educate people about health, factors that influence, how to improve it in public. And then we have Public Health Essential 8, which is build and support a diverse, skilled public health workforce. These are core principles, as I mentioned, of our academic health department internship program. So as you listen to the students, you'll hear some of these examples, and they'll probably, hopefully all tie back to either essential service number 8 or essential service number 3. And then to be clear, as they perform these essential services, the health department, our health department partners are benefiting in a collaborative way by working with these students to perform these services. Great, so let's talk a little bit about the recruitment. So every semester, we have a group of academic health department interns, and we find them fall, spring, and summer. We advertise these student internship opportunities. I use both the College of Public Health website and Handshake, and I know Handshake is at a lot of universities. It's open to all students at our university. And with Handshake, it's great because prospective internship preceptors, so me, I can search through resumes and then reach out to prospective students directly. So I can hear from a health department if they really want somebody with a certain skill set. I can kind of look beyond just our public health students and look at the greater university. I prioritize recruiting students from the community where the health department is located. bilingual, graphic design experience, strong cultural competencies, and students with excellent communication skills. Then I hold about a 30-minute interview with a student, a prospective student, to confirm that the internship will be a good fit for the student, our college, and our health department partners. We also try to recruit students from a diversity of majors to create a true interprofessional experience. Of the 29 academic health department student interns since fall 2019, 10 are from non-public health majors. So once the students are recruited, I complete paperwork with the students to identify their internship goals and 3 to 4 activities they will complete this semester to meet these goals. The onboarding structure is streamlined. During the first week, students watch webinars of academic health departments found through the Public Health Foundation, so kind of like this, their website. They explore the academic health department website and begin meeting with health department partners. Students are enrolled in either 3 or 6 credits, either 270 hours or 135 hours, and they can spread those credits over 2 semesters. I just want to make a note that these graphics were actually designed by another intern. So you'll see some fun graphics interspersed in our slides that have been designed by students. So now let's hear a little bit from our first speaker about the Academic Health Department Internship Program, Jessica Martinez. Jessica, take it away.
Hello, everyone. So as I mentioned earlier, I'm one of the interns with the Academic Health Department for MESCOF at the moment. I am a senior at the university studying public health with an emphasis in health promotion and education. And having grown up in South Tucson and being from the Spanish-speaking community, translation always formed a huge part of my life. So I've always remember having to translate and interpret back and forth between the 2 languages, whether it was from English to Spanish or Spanish to English. And it was something that was constantly happening. So it made me realize that many of the translations out there are not all there, like they're not specific with the culture, with the communities. So that was something that I wanted to prioritize in my internship experience and help out with. So growing up, like with the whole pandemic situation, I realized that the community, even though there was a lot of Spanish translations information out there, they weren't receiving it very well because a lot of it comes from a professional standpoint rather from the culture or from what the culture is, the community is experiencing at the moment. So that was something that I wanted to target. So therefore, a lot of my graphic work that you'll see in the next slide has been regarding the COVID pandemic and information. So my internship experience has been very rewarding and unique because although I am an intern with the Academic Health Department, I've also formed this joint internship experience with Pima County. And I've been able to work directly with Brian Eller, who's the school's liaison, and I have been able to collaborate with him and his team regarding infographics to meet the community needs for health promotion and for the safety reopening of our schools. At the same time, I have also had the opportunity to work on other projects that have allowed me to grow my professional network and help others outside of my own community, such as the farm worker community, which is also very present in our state. And although I do not form part of the community directly itself, it was very exciting to create something to help them and especially create it in Spanish directly for them. So without the whole translation back and forth. So that was really neat. So the next couple slides are examples of my work. For this first one, it's the graphic that I created for the farm worker community. It's the in this graphic, I was able to collaborate with 3 other counties and bring in information regarding the community, what they were experiencing, and items that we wanted to target in the infographic. So for this one, we wanted to target the cost of the vaccine. We also wanted to target and debunk a couple of myths that were going around regarding the vaccine. And of course, we also wanted to include the whole concern about identification and insurance on the graphic, just to keep them informed and just address the concerns. This next one is a graphic that I created with Pima County, Brian Eller's team. we collaborated on the different topics that were happening at the start of the pandemic. There was a lot of confusion between the terms. So quarantine and isolation and what each of these looked like. So there's just a graphic to explain those, and it was both in English and Spanish as well. And then this last one is an example of a graphic that I created in collaboration with Pinal County to target the work environment and their safety, and just to help ensure that all the mitigation efforts were being targeted and they were being practiced. So just to keep each one of us safe out there.
Thanks, Jessica. That's phenomenal. And thank you for showing. I can see the comments. You're getting a lot of compliments for your great work.
Thank you.
So now, speaking of Pinal County, we're going to hear from Erin Kenny about her experience partnering with Pinal County Health Department. Pinal County is a county that's between Arizona's two biggest cities, Phoenix and Tucson. So go ahead, Erin.
Hi, like Emily said, my name is Erin Kenny. I'm a senior at the University of Arizona, pursuing a degree in public health, and my role within the academic health department is as a graphic design intern. Over the past semester, I've been able to collaborate with research staff, professors of MESCOP, and incorporate information from national health resources into my work. From there, I have applied variations of these components to the graphics that I make for local health departments. So the main health department that I work with is Pinal County Health Department. I work around what their community needs are, which are mainly given to me by the epidemiology division manager. Many of my graphics have pertained to COVID-19 and addressing important questions a community may have. Vaccine promotion, a shortened quarantine guide, and COVID-19 versus allergies are a few examples of graphics that I have done. Through this internship experience, I have communicated and networked with public health officials as well as faculty and professors within the College of Public Health. I collaborated with Dr. Kelly Reynolds, a faculty member of MESCOP, to make two graphics related to disinfecting properly and keeping workplaces healthy, one of which I'll be showing in, I think, the next slides. Over the past semester, I've been able to make over 20 graphics that have been revised and edited to meet the needs of local communities. This thing has included many of them being translated and converted to Spanish. So the graphic on the left compares COVID-19 and allergies, which informs individuals on the similarities between these two health concerns. Ultimately, this graphic lets people know they should get tested if they are experiencing common symptoms. And the graphic on the right communicates what to expect after getting the COVID-19 vaccine and includes important information that individuals should be aware of. These are the graphics that I collaborated with Dr. Kelly Reynolds on. The one on the left is the English version and the one on the right is the Spanish. In general, it's important for facilities to know how to disinfect properly, but it's especially relevant with COVID-19. I think that's all my graphics that I have to show.
Okay, great. Thank you so much, Erin. I'm really excited because Erin is going to be staying on with us next semester, and she is already getting swamped from faculty and health department staff for requests for graphics. So I'm glad to have her continuing. So next, we're going to hear from Kendra. Kendra is going to tell us a little bit about her. Sounds good, Alicia. Sorry, I was just commenting to Alicia on the chat. Next, Kendra is going to tell us a little bit about her instrumental role in starting the academic health department in Graham County. So Graham County, as you can see on the slide, is in southeastern Arizona. If Kendra, I truly mean this, if Kendra was not part of this internship program, I can say with a 100% confidence that we would not have been able to break into this community and start working with them just because I didn't know anyone in Graham County. Kendra is proof of the importance of working with someone who is from the community for a successful academic health department relationship. Go ahead, Kendra.
All right. Hi, everyone. So like Emily said, my name is Kendra Claridge, and I'm from the small town of Thatcher, Arizona. and I'm a public health intern for the academic health department. So I'm currently in my senior year at the University of Arizona, majoring in public health with an emphasis in health systems theory and practice. And this is my second semester with this internship. So throughout this internship, I've been able to contribute and expand my website building skills. This includes building the academic health department graphics library, which I'll go a little deeper into what that is on a later slide. I've also been able to work with the Graham County Health Department and people from the Graham County Substance Abuse Coalition monthly to discuss their wants and needs and how I'm able to assist them with that by providing research and resources. All right, so I've been working with Graham County as a part of my internship because, like Emily said, I'm from Graham County. I grew up there. So it was important for me to be able to help the community that I come from. So I was able to initiate and grow an academic health department with them over the course of my internship. For those who are unaware, Graham County has a population of about 38,000 people. It's a very rural county, and it consists mainly of 3 small towns. As mentioned in the previous slide, the town that I'm from is Thatcher, Arizona, and that only has a population of about 5,000 people. So Graham County, it's predominantly a mining community. We have a very large copper mine that employs many people from the town. The mine's a big drawing factor for people because of the many employment opportunities, as well as it provides really great benefits. We also have a very large farming community, and we grow a lot of cotton. And families have lived in Graham County for generations, my family included. We're all very tight-knit. It's the kind of place where wherever you go, you're going to see someone you know. That's just kind of how it works there. So what I've been doing with them, so most recently, I've been working with the Graham County Health Department coordinator and assisting her in creating a youth mental health collaborative to help assess to help us assess youth mental health in Graham County. And so we're still in the early stages of that and are currently in the process of creating a resource guide for youth mental health providers and youth service providers that serve Graham County to help them address youth mental health, because that's not currently a resource that they have right now. So, and then I'm also currently taking mental health classes for school. So I'm able to bring to the discussion my own academic knowledge as I'm learning about mental health, as well as my own personal experience from growing up in Graham County. Another thing that we've been working on is we are collaborating with the Substance Abuse Coalition in Graham County. So I've been able to connect staff to college resources, including faculty who work in substance abuse prevention. Specifically, the coalition asked for information on naloxone distribution and trainings. So I've been working with another academic health department intern who's helped create an infographic that provides information on naloxone and what it is and how to administer it. So this infographic was created to be distributed throughout our community because Graham County is now a statewide naloxone distributor. And throughout this, we've been trying to really put a big focus on resilience among the community. So this is an example of the infographic that we created. We're still in the early stages of it and editing it to see what we really want on it. But this kind of gives you an idea of what we're doing to be distributed out to the community. All right, so the Academic Health Department Graphics Library. So this is a web page that I created last semester where I compiled all infographics created by past and present interns, and I organized them to where anyone can access them and download them for their own personal use. So this web page is constantly being updated as new infographics are being made. Most currently, I've been adding in infographics all about the COVID-19 vaccine, but there's an array of different infographics that can be downloaded. So many of the infographics on this page are available in both English and Spanish, as you see in some of the examples. They come in English and Spanish, and many are tailored to specific counties in Arizona, such as Pinal and Cochise County. So this webpage has proven to be very useful because people will look at these infographics on this page and see one that they like, and then one of our interns can tailor it to meet their needs or have it be tailored to a specific county. So people have been really liking being able to look at these different options of infographics and use them to their needs or request ones to be made just like them.
Thanks, Kendra. The Academic Health Department Graphics Library, like Kendra said, is open to everyone. One thing I will say, and I don't have this on my script, so I'm going off script, is sometimes the images when you download it look a little different. So if there's an issue, just email me, just reach out to me. My information's on the page and at the end of this presentation, and we're happy to share. So now we're going to hear from Aiden Grijalva, who will be speaking to how she utilized her experience working in schools, her fluency in Spanish, and public health background to support Pinal County, the same health department as Erin's, where Erin was working. So take it away, Aiden.
Thank you. So again, my name is Aiden Grijalva. I'm currently a junior at the University of Arizona, working towards my bachelor's in physiology and minoring in biochemistry. I currently am a translator and a manuscript creator intern for Meskov Academic Health Department. Although I'm not a public health major student, I find it essential to understand public health and how much they impact different communities and partnerships, especially if my goal is to impact others through medicine. Also, being fluent in Spanish speaking in turn has also brought its benefits because I get to speak for those of my community and discuss important subjects that I find crucial to include those who dominantly speak Spanish. So when I first started this internship, I brainstormed a few webinar ideas with Emily and Pinal County's Health District IDES Division Manager, Dr. Mariana Casal, and pinpointed the ones that we found the most important. So during this process, community partnership played a huge role. I was able to talk to a few of those in the Spanish-speaking community, as well as those around me, about any questions or concerns that they had in regards to the pandemic or any public health news that they were unsure of. So a common topic that kept on popping up was about the vaccines that were just released at that time. And also they questioned what was going on in schools in regards to the pandemic. And in general, many were just confused on what to follow in order to avoid the spread of COVID-19. I also constantly came across the issue that many of those in the Spanish-speaking community were not involved with information handed out from schools in regards to their children, and those who were informed showed confusion. So as a Latin community advocate, knowing that the majority of the population in Arizona are Hispanic people, I knew that this was something that needed to be addressed, especially during this pandemic. So once me, Emily, and Dr. Mariana chose to move forward with this webinar idea with the goal to inform parents and school staff about the pandemic and how to avoid a further outbreak, as well as keeping the children safe. So this webinar is also translated in Spanish, which I'm very excited about. Once this idea was approved, I began to collaborate with interns and staff from Meskov Academic Health Department and Pinal County Health Department to create this webinar. We also collaborated with different professors in order to collect data and analysis in regards to school benchmarks in Pinal County and school outbreak numbers. My experience with working at schools and with children brought a huge benefit to this project since we want to return to school as safely as possible without ruining the experience for children. Besides working on this webinar, I also provided translations for flyers and infographics made by fellow interns. So providing these translations not only allowed me to provide the most accurate translations in Spanish, but also work on my more professional side in Spanish speaking skills. So here are a few slides that show a few key point takeaways from the webinar. In this webinar, we covered what contact tracing is and its significance towards schools. Contact tracing is very important as it informs those who have come in close contact with someone with COVID, as well as taking action towards COVID before symptoms show. We also cover the subject of quarantine and isolation release. Many get confused and assume that once they are symptom-free, that they are free from isolation and quarantine. So here we show that not only are there different protocols for different scenarios in regards to those who are symptomatic and asymptomatic. We further that discussion with guidelines for schools for the rest of the pandemic, and we also cover different social distancing regulations based on school grades recommended by the CDC, as well as other guidelines that guidelines to keep in mind for the rest of the pandemic. Another topic we go over is COVID-19 vaccines. So we go over the basic information we know of each and remind everyone that any vaccine is a good vaccine. We also go over common misconceptions about vaccines and how they were debunked by the CDC. So overall, this webinar has been such a fun project to work on, and I am very excited to present it to different communities in Pinal County.
All right. Thank you so much, Aiden. This has been exciting. We've been finishing up the webinar. She's been working on 2 webinars, so we've been finishing that webinar up this week. So very exciting. Last but not least, we have Sophia. She's going to share about her experience with the Academic Health Department internship. Sophia has been working on kind of a different type of project. So Sophia, take it away.
All right, thank you, Emily. Okay, so hi, my name is Sophia Maitorena. I am a senior and I will be graduating with a double degree in psychological science and Spanish linguistics. So I am fluent in Spanish. However, I've always had an interest in public health and wanted to become more involved in helping the community in any way I could. This passion definitely stemmed from the pandemic in general, and I realized that the impact of public health and the science behind it, ranging from the individual to a more global level. And throughout my life, I've had exposure to the health field, my mom being a nurse and my dad working on the more business administration side of hospitals, such as the 2 main hospitals in Central Phoenix, which is St. Joseph's Hospital and Phoenix Children's Hospital. So my role here at the Academic Health Department is to collaborate with our coordinator, Emily, to develop a manuscript. And originally I was recruited to be a Spanish health educator and help translate any graphics as needed, but I'll admit this manuscript required more work than initially anticipated. This writing process is completely new to me, and despite how many academic papers and projects I've completed within my undergraduate career, it's different when you have to adapt your writing style to a new writing standard. And we aim to publish this manuscript in the health promotion practice as a submission to the practice notes section. So this is what they're asking for in the practice notes section is submissions highlight lessons learned, challenges and successes, and practical recommendations for working collaboratively in community or classroom settings. And we can also see a little snippet of our drafts so far. So what Emily and I have drafted in this manuscript is really concentrating on the student interns in the Academic Health Department because they are the backbone of this program through and through. And you can see that with every other example that have been explained in this presentation so far. And we hope that other prospective internship programs will take our insight into consideration when forming their curriculum and what they strive to do, such as emphasizing the essential public health services as they collaborate with other local health departments around them. And within the semester, I have personally expanded my own academic and research writing skills as I've been working closely with Emily to fine-tune these skills. But this also gave me a unique opportunity to network within the health community because I would like to continue my involvement in these types of projects, not just to educate and bring awareness to myself, but hopefully to educate and bring awareness within the community and beyond.
Oops, I knew I shouldn't have taken myself off mute. Thank you so much, Sophia. I really, great job. And I'm so excited about that paper. So I just want to echo Sophia, the students are a huge asset to the academic health departments and truly play such a huge role. But I also want to say the community and the health departments are huge. And because without the health departments, we wouldn't have an academic health department. So we're so grateful to collaborate with so many fantastic public health professionals who are both in academia and in the local health departments. But I just want to kind of, you heard from our fantastic students, and I just want to give a little end here with some tips from what I've learned with this internship program. I have to give a shout out to Julia Flannery with Pima County Health Department, because she has created an internship program and I've learned a lot from her. She started it before I started my internship program here. So she's been really helpful with this process. And as I've kind of gone through this, here are just some of the tips that I want to share with all of you. So first, it's all about recruiting the right students, finding the students who are a good fit. And sometimes those students maybe are not the students you'd expect. So I would say be open-minded when talking with students and looking at their skill sets, and willingness to learn from their students. Willingness to learn from students. They know their community. You know, you heard today from the students who talked about their community, and they know what their community needs. They can help you get to know the community. They really can be your biggest asset. And when you build that trust, I think, with the students, and you build that trust and they want to introduce you to people, they want to collaborate together, that is just huge, and it makes you feel really good. And that goes back to providing students a seat at the table. You know, my students come to meet with me to most of my meetings on Zoom these days. They're really a huge part of the work I do. I also will say I'm an extrovert, so I love working with people and talking to people. So they keep me sane. I also think looking at the benefits of the health department. So how is having the students involved going to benefit the health department? So we really need to look at whether academic health departments, making sure we're listening to our partners. How are we serving our partners? How are we working together to serve our community? And I think that's important. So knowing what your partners want or need from students as they request support for projects is really helpful. Involving them with the interview process with students is something that we've done before and has been really helpful. And then bring it back to the public health essential services. So again, these two essential services that I talked about before, I think this internship program does do both of these things. So help students to communicate effectively, to inform and educate people about health factors that influence it and how to improve it, and also build and support a diverse, skilled public health workforce. And it's just so cool to see what these students go off and do after they're done, after they graduate. And it's not just because of the internship program at all. We just bring in these talented students who, this is just one step on their way to fulfilling careers and their next steps in their journey. So those are just a few tips I wanted to share with you all.
Fantastic. Thank you.
Kathleen, let me turn it over to you. Sorry about that.
No, you're good. I had to find my own mute button. Thank you all for that fantastic presentation. It's so fun for us to hear about, you know, some of the on the ground work and what you're working on in your communities and through your internship program. You guys are doing fantastic work, and it's really nice to be able to learn a little bit more about it. We do have time. We have it looks like about 15 minutes or so. So we do have time for questions. Please feel free to drop your questions in the chat box, as I mentioned earlier, and we'll share them with all the presenters here. Or if you would like to ask a question out loud, feel free to raise your hand and we can just kind of queue up a line. There's a number of comments. I'm just scrolling through the chat box to see if we have any questions so far. There's a ton of comments. Congratulations and great work type of comments. The graphics that you guys have built are amazing, and they're clearly benefiting not only the health departments and the local communities that you made them for, but other communities within Arizona, as well as you've got a shout out from Montana here, so, and how that helped inform their own work. So that's fantastic to see. And we can share, Emily, I think when we'll send out the recording to everyone after the event. And I think we can share the link to that graphics library if that works for you guys. Yeah. And so we'll make sure that you all get that. So yes, please feel free to put your questions in the chat box. It looks like Oh, and Kendra, thank you for dropping the link to the graphics library in the chat box as well. It looks like our first question is for you, Sophia, and it relates to, can you remind us which journal you hope to publish your manuscript in?
Yes, the Health Promotion Practice Journal, and I can even type that in the chat for reference so that if it's easier to remember too, but that's where we hope to publish.
Awesome. And I think that journal is out of the Society of Public Health Education. Yeah, perfect.
I believe so, yeah.
Yeah, thank you. We have a question about the transition to virtual internships. Do any of you want to say anything about the transition to virtual internships as a result of COVID? Any highlights, any things that were really different or worked really well or didn't work? And Emily, maybe you would have the overall perspective, but I would love to get.
I can say something about it. I think it's very different for sure. I really didn't, I didn't think it was going to come out this way in the sense of working constantly through Zoom or emails. I was like worried that I wasn't going to be able to connect with, my other fellow interns. But towards the end of it, I actually got to work recording the webinar with Erin, and just me and her having that individual work and going through Zoom and practicing and all that stuff was actually really cool to get to know her more. So it's definitely possible. It is a little bit of a barrier, but honestly, I think it was still a very interesting experience. And it also was really flexible with schoolwork, so it didn't feel super overwhelming.
Great. Anyone else have any thoughts on that?
I can touch on that. Since I've been working with my community that I came from, I actually think that having it be all virtuals actually kind of been more helpful to me, because I've been able to meet with these people a lot more than I normally would. Because if it was an in-person internship, I'm here in Tucson for school, and so I wouldn't have been able to meet with these people from Graham County. So for me, it's actually kind of worked out. It is a little weird having to constantly be on Zoom all the time, and I wish I could, meet these people in person. But like Aiden said, it's also been really nice because it's allowed more flexibility, definitely, with having to bring in all of our schoolwork as well as our internship work.
Fantastic. Emily, do you have any thoughts on that from kind of the coordination aspect? I'm sure you'd had to do a lot of work to kind of switch gears.
Yeah, absolutely. Yeah, it's funny because I actually was really nervous with the transition to online and with the students. And I was just like, oh my gosh, how am I going to make this exciting for them? Because so much of the internship was going to meetings and meeting these people, going on tours of health departments, for example, and I was worried. And I will say, I think part of it is, maybe we've gotten used to it because it's been a year of this. So I think at first there was kind of a level of disappointment just because I couldn't take the students with me to meetings. We couldn't do that. But I really think that they are, it's worked out really well. And I think in some ways having the Zoom has been great because you have that dedicated time where with somebody and, I actually think it's kind of made the relationship more one-on-one, which has, I think, been good for both the student, I think probably for the health department, maybe really getting to know our students through that one-on-one meeting. And then I think I feel the same way.
Awesome. Thank you. We have a question about any barriers or challenges you might have experienced and whether you have any tips on overcoming the barriers that you may have encountered in doing internship work.
So I want to touch on that. I have to admit that my internship at the beginning was a little rocky. It was a little all over the place just because projects got switched over and things. So from the student perspective, I would advise to keep an open mind and to not get very disappointed right away and try to find something else, because public health is always changing. Things are always moving forward, so just adapting and what's the word? Sorry, I lost the phrase that I was going to say, but just adapting and keeping an open mind, you know, talking to the partners that you're working with, like in terms of preceptors, coordinators, see, you know, what can be done. But that's the student perspective. I don't know if anybody else wants to touch on that or if Emily wants to touch on that.
Yeah, I would say, you know, with the students, definitely it is. And that's something I always tell the students when they start their internship, especially Jessica was with me this semester, but then she was also with me in the fall. And, you know, that was when we had the COVID, you know, it kind of went down for a little bit and then it started spiking, and it was a little bit chaotic, you know, because things would change constantly, what we were focusing on, what the health departments needed, what the community needed. And I think that was, it was like real time, right? Like, you know, it's kind of like we're running around changing our plan. But I think it was a really good learning experience. I think we all were experiencing that same level of chaos in the public health world.
Awesome, thank you. Emily, we have a question for you. I don't know if you know the answer to this off the top of your head, and if you don't, we can certainly follow up. But we have a question, whether you know how many students who complete an internship through your AHD program end up working in health departments after graduation. I know we've talked a little bit one-on-one about students doing contract work for health departments even before graduation. So I don't know if you have any thoughts on that.
You know, that is an excellent question. And I actually don't have that information right now, but I can find that. And that's actually something at this point, because we've had the internship now for a while, we'll be able to get that data. I will say, just given what I know and what I would say about 50% of them probably do end up working at local health departments, but I can certainly follow up with you, and that would be great information to know.
Fantastic, thank you. Yeah, we find a lot that, you know, just sort of the exposure on both sides, of being able to get some experience working in a health department. Often, you know, you learn something that you may not have known you'd be interested in, or it might not have occurred to you to think about. And conversely, we have a lot of health departments mention that, you know, getting to know students before they graduate means they know who they want to, you know, snap up as soon as graduation happens. And so that can be a really nice connection, I think, and a really nice pathway into governmental public health. We have a question about whether you've worked with students who are writing thesis or capstone projects, as you know, kind of as part of this, and if so, how those collaborations worked. You have any thoughts on that, Emily?
Absolutely. Yeah, so I have. So these are all undergraduate students, but Sophia is writing her thesis. So I have, but with the graduate students, it's definitely more involved, working more with the professors and the faculty. I will say that I've done that with our accreditation. I've managed a few interns who worked with accreditation, and that was actually looking at where our alumni are working. So kind of going back to that previous question. And I would say that was a really interesting, you know, I worked really closely with the faculty to get that data, and then with our health department partners, and then the student really was the connector, just like with this internship. I will say I feel really grateful that the relationship, so I actually am a graduate of the College of Public Health. I got my MPH in 2015 from NSCOF. And I feel really grateful that I have a very strong relationship with our faculty. And I do feel like we work extremely well together. And so it makes it really easy for managing student projects, whether that be some kind of thesis with the graduate students, or even with the, you know, these current students who are so fabulous. Working with our faculty, that relationship is just key. And I think I'm really proud of that relationship that, you know, I have, that our students have with our faculty, and that the relationship we have with our health department partners.
Thank you. Fantastic. I'm trying to keep track of the questions as they come in. We have a question about, we've alluded to the switch to virtual, having to do internship activities virtually. How do you think that using these digital platforms like Zoom might expand? Do you see that expanding the internship programming that you do, or how does that play in?
Absolutely. That's such a great question. And, I'm just, and in some ways it's like, this has been such a hard year, but it has made us really nimble, right, and innovative. And we have the College of Public Health, we have online programs. We have both an online program and an undergraduate and then a master's. And, one of the components, and as you saw in the presentation, is trying to recruit students from their local community to work with us and work with the health department. So one of the things I would really like to do is continue to recruit from our, great pool of in-person students, but then I would also like to continue those relationships with our online programs, because those students a lot of times are currently working and living in those communities. So I would say that that's something that's definitely, for me, made me realize that we really need to tap into those students even more and see where they're coming from and how we can engage them in ways where they can really represent their community with projects and initiatives between the college and the health department.
Makes a lot of sense. I'd like to, so we're getting close to time. I'd like to try to squeeze in two last questions. One being, what advice, I know we've talked about tips and sorts of things as we've gone through this. Do you have any additional advice for those in the audience who are interested in developing AHD partnerships at their own institutions? Anything we haven't talked about that you'd like to highlight in general? It could go beyond internship programs, I suppose, if you wanted it to.
Yeah, I think the biggest piece of advice, and I've learned this, and I have to give a shout out again to all our fabulous county health department partners, because they have all just, in Arizona, they've just taken me in under their wing and taught me so much. So I would say the biggest thing, in my opinion, is listening to the needs of the health department, because they know their community, and really having them drive what those priorities are. And then matching them with the appropriate faculty who are in that area, or the students that are interested in the area, but they know their community, listening to them and making sure that it's about the community. It's about those, it's about those partnerships. And I kind of saying the same thing, but I cannot articulate enough how important it is to listen to your local health departments, and in that relationship is just so important. It's gold. It's gold. That's what I would say. So.
Oh, fantastic. And I would love to give all of our student interns the last word here. We have a fantastic question that asks about what each of your proudest accomplishment or key takeaway is as you finish up. I know for many of you today is the last day of your internship. So as you finish up that experience, what's one thing that you're going to take away from this experience? I don't know, I can call on people. So maybe Aiden, you're first on my screen if you want to chime in.
I think overall what I took out of this is all the networking opportunities that I've gotten, and just staying in contact with those people, as well as overall how much of an impact I've made to different communities, and letting them know that, yes, I worked on this webinar, and they're like, oh, can I please have a link to it? This would be great, especially those of my family and their friends who have no idea what's going on with the pandemic in regards to those translations. So yeah, that's basically my experience.
Awesome. Thank you. Kendra?
Yeah, so for me, I'm just super proud to have been able to work with my community and help them out, and provide them with resources that they might not have otherwise had if I hadn't, reached out to them. And it's been really grateful getting to form relationships with these people from my own community. I've also loved maintaining the graphics library, because I know that a lot of people use that, and a lot of people are grateful to have all these different graphics that they can use. So it's been great. I've loved it.
Definitely. Thank you. Sophia?
I think overall, like this webinar one is one of the things I'm really proud of. I've had fun presenting, and I think throughout this whole internship process, just even being able to really develop a manuscript and hopefully be able to publish it, because this will be my first publication in any sort of journal, and that makes me like ecstatic about that opportunity and just what that will allow, and just being able to, I guess, contribute to the greater science community overall and for public health.
Fantastic. Thank you. Jessica?
Like Erin said, I think the networking and be able to meet all these different individuals within my community and just be able to contribute back, you know, especially with the school settings, because I want to work with kids in the future. And I have 2 younger siblings who I know my mom was worried with the reopening of schools. So just being able to have that little work put in and, you know, and give back.
Thank you. And Erin?
Yeah, I think just being able to collaborate with so many different individuals and seeing how you can come together for like common goals. And I know right now with things being so chaotic, it's not difficult to complete projects, but it's just, I guess, getting people to all be on the same page, but then seeing the final product and seeing how everything turns out is just such a great experience. And it's been great to just collaborate with so many different people throughout this past semester.
Fantastic. And we appreciate your sharing all of the work that you have done with us. Not all of it, I'm sure you've done much more than this, but giving us some insight into the work that you have done. And this has been incredibly interesting. And as I mentioned, it's really fun to hear what's going on the ground. We wanted to leave you all today with just a handful of resources that are available if you're interested in diving more into academic health department work. So the link to where the learning community lives online is in this slide. And I think we can drop the link for the slides back in the chat box if you didn't have a chance to grab them earlier, so that you have these links. But we have some information online. This is, as I mentioned, is part of an ongoing webinar series. So all of the archives of the previous webinars are available, and new events as they're scheduled are posted on our website as well. We have a number of resources and tools, and we have a regular newsletter where we share the latest of what's going on in terms of HD resources and events. And of course, as always, please feel free to reach out to me at any time if you have questions or you want to talk anything through. So with that, I would like to once again give a great big thank you to all of our presenters today. You all are doing fantastic work, and I hope you can see all the love that's happening in the chat box for what you've shared with us. We really appreciate your sharing your time and your effort and all of that you've worked on with us today. And I want to thank everyone in the audience too for joining us for this presentation. I hope you all have a good rest of your day, and that we see you again next time. Thank you so much.